right, it's our final segment this Monday morning with Clint Kelly. He's our malpractice attorney. Taking your calls. If you want to jump in, we're going till 9 o'clock. Any questions you have about maybe a case you're looking at? We got a couple more calls that waited through the break, Tim, and let's go to. Tim's next. You're Clint. Let's go to Tim. Tim, good morning. Hi, Tim.
Good morning. Can you hear me?
Yes. Go ahead, sir.
Good deal. Hey, I just want to make a quick comment on overhearing, turn the TV on about the nurse practitioners.
Yeah.
I have, just as a heads up, I have worked with some excellent nurse practitioners, and the difference between them and so many other ones is that they start out as RNs with tons of clinical experience, and then they gather more and more and more, and by the time they're NPs, I've seen them go toe-to-toe with an awful lot. Now, you've got a major university in this town is allowing people to go to nursing school and bridge all the way to NPs, and it is absolutely scary. They're turned loose into the hospitals, and I've seen so many of them fail and get turned around and say, sorry, it doesn't work. Item number two, or topic number two, might be off the topic a little bit, or off the subject, but for the last 10 years, I have watched tons and tons of patients come on in. 3 or 4 of our patients, sometimes that we may be assigned to, are given an ungodly amount of narcotic use for pain control. It is way out of control, and I just wonder why a doc can write those kind of heavy-duty overdose narcotics, write the order, let the nurse do the grunt work without being questioned on that. That's all.
Hey, I'm just curious, without giving it away, are you a doctor yourself, or a nurse? You work in one of the hospitals?
No, that's correct. I'm an RN.
Okay, I was just wondering, yeah, so you have some firsthand experience seeing some of this stuff. I really appreciate your call. Those are some excellent points. What about it? I mean, that's interesting. I agree with him. The nurses that I've dealt with and the ones that my doc have a ton of experience that I think they've just picked up over the years, and it serves them well. You know, getting these young ones right out of college, they can't compete with these nurses in terms of, I think, with their education.
Yeah, he's talking about the nurse factory that's producing, assembly line producing these nurse practitioners who don't have the type of experience or training to handle complications like the ones who've been doing this for a while. But I want to talk about the narcotics issue for a minute. I know someone who had a nephew overdose last week. He was 30 years old. It was fentanyl, which is right now the rage.
Yeah, it is.
But it all started with this young man taking Vicodin after a procedure and taking it more and more often. And the problem with the narcotics Tim raises is this. You've got a whole swath of the American public. New Hampshire's probably Exhibit A, but you have it in West Virginia as well, and some of the rural areas where people have gotten hooked on these pills, and then they get off the pills either because they've been arrested or their doctors cut them off. They're still addicted, and so they go straight to the cheap alternative, which is heroin or fentanyl.
Right.
The problem with fentanyl is you cannot predict, you cannot know when you take the drug what the dose is for sure, and so you overdose. And people are dying left and right, Nick, because of this, and I don't know what the solution is. I'm not a doctor, but it's happening.
Maybe this is separate, and I know it can be criminal, and we've done stories on pill mills and things like this. Can you sue a doctor for overprescribing a narcotic?
Absolutely.
You can?
Absolutely.
Oh, okay. Well, I was going to say,
there is a standard of care for prescribing medication, and there are rules that apply in situations where you give it, and there are situations where you shouldn't give it. There are situations where you give one dose, or situations where you give another. Always the risk in this situation is that you may create an addiction. And when that happens, addiction's just a disease, Nick, like heart disease or cancer. It is a disease that has a natural progression, and it can kill. So this is going to be an issue we're going to be dealing with for many years to come, and I don't know what the solution is, but people are dying from this.
Yeah, oh yeah, with plenty of stories and how awful it's become. Let's go to Wilma. Hi, Wilma.
Hi, good morning.
Good morning. How can we help you?
I was watching your show, and I have a question about the DNR order.
Yeah, do not resuscitate? Okay.
Right. My husband was in the hospital. He had fell and broken both of his legs. and he was in the trauma unit, and they moved him to a room. The doctor went in and talked to him, and she later called me and told me that he had agreed to the DNR order. I have no proof that this was written. My husband had a laryngectomy, and he had not spoken in 2 years. She spent like 45 minutes with him and then tells me this. And he died as a result of it. I'm sorry.
I'm so sorry.
And I don't know if this was legal or not.
Wait, Wilma, what did he die from?
Yeah, what killed him?
They took him off of everything because she came to me and asked me, she said, "Did you understand what I told you?" And I said, "Yes, you told me he was dying, but I didn't realize that, it was then." You know what I'm saying? I mean, the doctor had come in that morning, and he was supposed to have surgery on both of his legs. We understood that he would probably have to go, to a facility, for rehab. And then she came in later that afternoon and told me he was fine.
Did he have, I'm just curious then, did he have other conditions? But I mean, it sounds like 2 broken legs, that's not going to kill you. Yeah. What else was he suffering from?
Right.
Well, I mean, he had cancer. He had to have his laryngectomy, but he had not spoken in 2 years,
But he was not dying when he went into the hospital before he broke his legs. He was okay?
Yes, we were getting ready to go to a doctor's appointment then when he fell and broke his leg.
When did Wilma? When did this happen? When did he pass away?
August 20th.
All right, Wilma. What I want you to do is you call my office. They should be there now. It should be open. And when you call my office, I want you to ask to speak to Nurse Kathy. Ask to speak to Nurse Kathy. And then I want you to give your information to her. I've got questions I want to ask of you, but there are other people calling in, and she'll get the proper information from you, and I can make a judgment. And there's the phone number on the screen. It's 615-824-3703. And you just tell them I told you to call and ask to speak to Kathy, and then I will review the information. Both Kathy and I will, and we'll get back to you and let you know whether we think there's a case, because there's something going on here that we need more information.
Okay, Wilma, we'll put that phone number up again on the screen. If you can get a pen and paper before the end of the show, you can write that down, okay?
All right, thank you.
Okay, thank you for your call. What is it that, what are the kinds of questions? Again, we're just hearing from her side, and obviously she's very upset. I really sympathize with her. But what jumps out at you here?
Oh, why did he die?
Yeah.
Cause of death is the number one question.
Yeah, 2 broken legs. He had a laryngectomy, or his throat or whatever. He had throat cancer, but it sounded like he was okay. So he breaks his legs. Now, why would a nurse, get a DNR from someone in the hospital like that who can't talk?
I don't know. That's another issue.
Just doesn't
obviously,
make sense.
is was he competent to do that? I don't know. I mean, there's just a lot of unknowns here. But anytime someone goes to a hospital and dies under suspicious circumstances, that's a case I look at.
Yeah, absolutely. I'm glad you're taking her number, because with the DNR too, even if there wasn't one in place and then he's in the hospital and they know there's a family member, even if somehow this nurse through her communications with this guy decides he wants a DNR, before he takes a turn for the worse and I unplug him, I'm going to at least talk to his family. Not that they have a choice if it was his call, but how do you not let his wife know about that? If again what we're hearing here is accurate. How do you not do that? If his wife was not aware of a DNR, he maybe verbally or somehow wrote it down in the hospital after he was there without anyone else knowing, and then he dies, and they don't let the wife know? There's something wrong with that.
It sounds sketchy, and that's why I want to take a look at it, because there's some things that don't add up here.
Okay, well, the thing is that happened in August, so it's within the statute of limitations. That was one of the key questions.
Classic example of why people ought to call as soon as possible. Plus, the evidence is somewhat fresh. You can take a look at it. And
yes,
it hadn't gotten dusty or obscured. So, kudos to Wilma to call in. And it doesn't cost Wilma anything to call and find out whether she's got a case or not.
Yeah, that call will not cost you a thing, and you'll figure that out in the statute of limitations. So that's why if you're sitting at home and you think you have a similar situation or something like that, don't wait a year.
Right.
Or he's had great cases walk through the door and he asks, when did this happen? and it was just over a year. And that's it. End of story. Real quick, I always like to end with this with you because I'm telling you, he's the guy I'm going to turn to when I have to go. What is the questions? If you need to go in for surgery or a procedure, what question or what are you looking for in the hospital you choose? I'm just yourself. Well, how are you going to check?
Well, certain hospitals have a reputation for being cleaner than others.
Okay.
Certain hospitals have a reputation for being or providing better care than others. I can't get into that obviously because can't.
Yeah.
But what I look for is a hospital that has a good cleanliness record, a good quality care.
Is there any way to check some of that in terms of complaint? That it's public. I understand that. I mean, how do you know? I go to most hospitals and I look around and I smell antiseptic. It looks pretty clean. I don't see puddles and dirt on the floor. I mean,
you know, Nick, there's no public reporting of infections or complication rates at hospitals. They don't have to report those things in a way that's consumer friendly. So the only way to really know is word of mouth.
Yeah, and if you go to a facility, and of course if you're sick, it's hard to do it. Have a loved one with you or a friend, and if they see something that just doesn't look right, call them on it.
Right. I mean, I have lots of friends and family call me and ask me for my opinion because I know I'm in the business.
I will be one of those. But I understand, and it's
unfortunate that the regular patient, Joe Blow consumer, doesn't have access to that information, and all they can go on is word of mouth.
Yeah, word of mouth referrals, people that may know. Hopefully your general practitioner, if it's someone you trust and you go to them, they have knowledge of certain places.
Nick, before we left, I did want to raise this
real quick.
Study.
Yeah, we've got about a minute.
All right. There's a study that came out about malpractice cases, and this was written by a doctor, and the doctor said the #1 reason there's a lot of malpractice is there's too much malpractice.
Yeah,
talking to doctors. He said the first way to reduce complications and infections is to get doctors to start washing their hands more often.
That's just
Can
basic.
you believe that?
Wash your hands before eating dinner. Wash your hands before performing surgery.
I took it as a given. They all did, but apparently they know, the doctors who participated in the study know there's a problem with them washing their hands.
And you said because washing hands takes time.
It's exactly.
And the more time you take, the more money goes out the window.
Right.
And that's the bottom line in all of this, folks. Costs and how it works. Clint, awesome.
Enjoyed it.
Pleasure seeing you. Have a wonderful holiday.
Thank you, too.
Appreciate it, my friend. Be back with a programming note about tomorrow right after this, everyone. Stay with me.